Better skills suited for all births. It's simple. 100% of pregnant women will give birth, and your birth is important to you. When these skills started to develop in the early 1970s, it was in the United States. We did have, from the 60s to the 70s, a very high societal expectation that everybody attend the first childbirth preparation classes taught, and those were Lamaze, and for some people it was Bradley. That meant labor and delivery nurses and obstetricians saw multiple millions of women for the first time in history using some form of skills to cope and manage, and fathers were just coming in and they were using birth coaching skills to help the woman cope and manage so that she wouldn't suffer. This had a profound positive change on childbirth. Sadly, the natural birth advocates of that time, from the 50s to the 70s, in Lamaze and Bradley, and in New Zealand, Grantley Dick Reed, they focused on low-risk women and normal births, pain-free labor with no medical interventions. Huge mistake. It should have always been 100% of pregnant women are going to give birth. We all need skills to birth our babies. And the Birthing Better families who developed these skills knew that. It was about their baby's birth. The next group of birth advocates in the late 70s and 80s actively dismissed skills. They said cows and cats aren't taught to birth. Women don't need to be taught to birth. They just need to make choices and be left alone. Women didn't want to be left alone. They had suffered being left alone before. They didn't want that. So we want you to know that Birthing Better families developed these skills because they wanted skills for their birth. And you need to want skills for your birth. There needs to be a societal message that tells you and your partner or whoever your loved one is, you need to learn skills during your pregnancy and then use them during the birth of your baby. Because if not, you will be passive and you will feel as either it was a nice experience and they were nice to you, or you will feel that you had a bad experience and you didn't like how people treated you. And that's not okay. This is an activity you're going to do. It's a one-off, infrequent, life-transforming activity, and it has a birth story attached to it at the end. It's what you remembered. Birthing Better families rarely talk about what they did or didn't do to them, or even what type of birth they had. They talk about how effective their breathing skills were, how effective their communication skills were, how effective it was to prepare their body for birth, how effective it was to use skills driving to the hospital for their non-laboring cesarean. We looked at birth from the viewpoint that it was an activity we need to be skilled for, and we want you to take that on. So learn now. Be encouraged. We've used Birthing Better skills in every type of birth, every type of birth. You know who hasn't used them? The women who really say, can't bother. I'm too busy. And you say to them, well, are you going to be busy once your baby is born? And they go, oh, no, of course not. Your baby's here now, and your baby wants you to become skilled. So do it. That's it. Special message to you. Bye-bye.